Good morning. I'm Dr. Manjini, Associate Professor in Department of Pathology. I'm working as pathologist in Bharat Medical College and Hospital. So, in pathology, we examine specimens, blood samples, and all the uh, carcinomatous compounds. Like if a patient is coming with any viral illness or any bacterial illness, or he's complaining of fever, the first and the foremost investigation will be an routine blood investigation, which will come to our pathology department, and further on to categorize the disease, further investigations will be done. That is called as the hematology division of pathology. Next, if a patient is coming with any swelling or any cervical lymph node, to categorize the patient whether he is suffering from any tuberculosis or whether he is suffering from any malignancies, the FNICs will be done in the department. The division of that pathology is called as a cytopathology. Further on, to categorize the disease, the tissue samples will be coming to us. Further, this will be processed, and this branch we call that as a histopathology. And in the histopathology, the cancerous and the precancerous lesions will be managed by block sectioning, and further categorization of the patients can be done by molecular techniques like PCR. So it goes on. So all branches of pathology are covered over here to help patients and to serve them. First, any graduate who has completed his 12th standard, he has to go for a common entrance examination now, which is followed as NEET. So before going in for NEET, he can be a CBSE student or a state board student. He has to undergo a few coaching classes, which will be helpful for him to attend the NEET, because NEET is a very competitive exam which can't be undertaken without any previous coaching. So the candidate should undergo a self-coaching, or he can go to any coaching classes and he will appear for the NEET exam. This is called as the qualifying exam. After getting qualified in the qualifying exam, the candidate should pursue the main degree called as the MBBS. After pursuing MBBS, this is an 4.5 years with the internship, which will come to 5 years course. So 4 years will be like, the first year they will be reading the basic sciences. It will be comprising of anatomy, physiology, biochemistry. The second will be the paraclinical subjects. Before entering the clinics, he has to know this pathology, microbiology and pharmacology. Next, it will be for 1 year. 1 year duration, he will be entering into the preclinical subjects like ENT, Ophthalm and community medicine, where he will be going for a field trip and he will be assessing the family, and they will be learning the community integration. With the community integration, what the people are suffering. So that will be like a paraclinical. Next, he is entering into the clinical subject, which is comprising of the general medicine, general surgery, obstetrics and gynecology. That will be the main core of the subject. After completing the final year, pediatrics. So pediatrics, along with all these subjects, small minor surgical divisions are like like orthopedics, anesthesia, dermatology, where they will have minor postings. So after completing the final year, 1 year complete rotatory internship will be there for all those students who has passed and got the provisional pass certificate. After completing the provisional pass certificate, with the provisional pass certificate, he can go for an internship, which will be for a 1 year duration. Here, they will be posted in all the clinical subjects along with the allied subjects like dermatology, ENT, Ophthalm, anesthesia, all these subjects, and in community also. So community postings becomes a very important part of your MBBS curriculum. So there will be a 1 month rotational posting in community also. And after completing all the postings with the logbooks and everything, he will get the certificate and he can go for an registration. After completing the registration, he is allowed to practice as a general practitioner. And persons People who are interested in pursuing additional higher qualifications can go in for an NEET exam, that is called as an specialty exam. Okay, so this is called as the PG NEET. So now there is the GOs haven't passed yet whether they will have an exit entrance exam also after the final year, but as of now they have to appear for the PG NEET. So whoever want to go in for an post graduation after the MBBS, whether he want to take an MD anatomy, that is preclinical subjects like anatomy, physiology, biochemistry, or paraclinical subjects like pathology, microbiology, or pharmacology, or this paraclinical subjects like ENT, ophthalm, or the final year subjects, everybody who want to pursue one postgraduate degree should write a NEET exam. After qualifying the postgraduate NEET exam, he, according to the marks and the allotment, he will be allotted seats in various medical colleges, government and non-governmental colleges. So this degree course, whether it is going to be an MD, MS, all the surgical fields like your orthopedics, obstetric and gynecology is called as Masters of Surgery. All these paraclinical subjects and the preclinical subjects, like wherever there is an operation like your ENT, ophthalm, all these are called as Masters of Surgery. So they'll have MS ENT, MS ophthalm. All the preclinical subjects and your general medicine, they'll call as MD. Okay, so Doctorate of Medicine. So you have to study for 3 years. So the course is for a 3 years duration, and after the 3 year completion of now when you are going for a master, you will be posted one. You will be pertaining to that course alone. So if you want to go for an MD, suppose if you want to go for an MD pathology, it is a 3 years course. You will be there only in the pathology department. So the pathology department is having different divisions like your histopathology. So as of now, as I am a pathologist, I would like to brief you about the pathological aspect of post-graduation. So what will be there? You will study for 3 years. In this 3 years, what all you will learn? You will learn about hematology, histopathology, cytopathology, and your molecular diagnostic techniques. So to complete your post-graduation, you have to do your thesis. So the thesis is one mandatory part, and you have to do publications pertaining to your subject. In the first year, you will have all the seminars, case presentations and everything, and you will be in rotational postings in all these 3 divisions. And finally, there will be an exam with the external examiners and the internal examiners, and your thesis has to be approved by the university where you are studying, and they will offer you a postgraduate degree. So all these, after post-graduation also, there is super speciality in certain subjects. All the clinical subjects like your medicine, general surgery, your OBG and pediatrics all have super specialities. Like if you are going to become a pediatrician, there are DM neonatology, DM endocrinology. So there are super specialty courses. Again, these super specialty courses can be pursued through NEET. So any person who want to enter MBBS all have to appear for the NEET exam, and if you want to go for a super specialty also, you have to appear for the NEET exam. Then after clearing the NEET, you will go for a super specialty degree, that is you can go for a DM super specialty in various branches. One such example is your cardiology, nephrology. So these will be like super specialist, and you can complete your super specialization. So average salary after completing your MD pathology, you will be getting around 80 to 1. After some certain experience, if you are working in medical colleges, your promotions will be there. First after 5 years of experience, you are called as associate professor. So when you are entering into that cadre, your salary will be increasing to 1.5 to 1.2 to 1.5 per month. And after after 3 years of associate professor, you are called as professor. So 1.8 to 2K It's actually an interesting field, and it is an upcoming field of medicine. That is one branch of medicine where you can explore diverse disease conditions, and you can always feel proud as a pathologist because you are diagnosing and you are telling the treating clinician the patient is suffering from this condition. Though there are some clinical signs and symptoms, but you can always be proud as a pathologist that you are diagnosing the disease state of the people, and you are categorizing whether he is malignant or non-malignant, and you are staging the patient, and you are able to help the clinician in treating the patient. Best part about a pathologist is like you are in hand with the clinical subject. You are not out of the clinical scenario. You are along with the clinician, you are working in the hospital side, and there is some amount of relaxation also where you will not have night duties. So for an doctor who want to work from morning 9 to evening 6, it is an apt job actually. And the families can be, if you are going to become a clinician, it is little bit a hectic job. Job of a pathologist is also going to be hectic, but there is some amount of relaxation where you can spend time with the family, you can take care of the kids, and you can do a better job. Actually, now the field is branch of pathology is emerging and it's diversified. Like it's not only stopping where there is like you have diagnosed a cancer and you have got, no, you are entering into the molecular level why the cancer is occurring. Like the field has entered mostly into the clinical part. Like it's an ever-ending field, and it is having various molecular diagnostic techniques. So there is many scope over here. Not only histopathology, like the hematological part is ever-ending, where the hematological malignancies and the blood cancers, the diversification is going beyond the scope. So there are like the super specialties in pathology where you can confine to histopathology, or the one journal you can take like hematopathology, and you can flourish yourself in that. When you are becoming hematopathologist, all the cancer people are going to come directly to you, and you are going to treat them, you are going to diagnose them. As a pathologist, you are going to diagnose them, then you are going to assist in treating. So the field has various perspectives, and the future is ever ending here. While entering into the field of medicine, we have to dedicate ourselves to the patients, to the community. So the wide acceptance of the people in whatever manner they are, but we have to give our full support and treatment. Thank you.